Hi, this is Christy Mendoza from South Bay Total Health, and I'm here to talk to you about something that's not so fun today, which is what do you do if you're in quarantine? Also, am I sick? Do I have corona? Here's some guidelines coming from China on what to do if you're self-quarantined or if a family member is. Now we're starting to hit more quarantines, so this information, though not very exciting, is timely, so please tag someone. Later we'll do meditations and Qigong to strengthen the lungs and a lot of fun stuff. Might move my clinic to a virtual clinic online via Zoom. Stay tuned for that. I really hope it doesn't come to that, but I do have a lot to share if it does. All right, let's get into this. This is coming from the Guidance for Coronavirus Disease 2019 Prevention, Control, Diagnosis, and Management coming out of China. We're getting a lot of really good info coming out of China, so I'm looking to them for guidance. All right, living space arrangement. People with suspicious symptoms need to live in well-ventilated single rooms and refuse all visitors. So what does that mean? Keep that person in one room, keep all the windows open, not all the time, but keep airflow going. If you have an air filter, even better. Family members should live in different rooms. Stay at least 3 feet away from the person at all times. Sleep in separate beds if conditions allow you to. People with suspicious symptoms should limit activities, limit exertion, limit their living space, and ensure that shared spaces such as kitchens and bathrooms are well ventilated with the windows kept open. Caregiver arrangements. It's best to have a very healthy family member take care of your sick family members, because those with previous conditions and health conditions are going to be more susceptible to catching the virus. Spreading prevention. Family members live with people who have suspicious symptoms should wear masks that closely fit the face at all times. Keep your hands clean. Avoid direct contact with surfaces, body secretions. Do not share things that might cause transmission. Okay, so we want to isolate the stuff they're using. We want to use bleach to clean it. Be very meticulous about hygiene. Treatment of contaminants. Use gloves, paper towels, masks, and other waste should be placed in a very special separate garbage bag that's marked contaminants. You're going to keep that in the patient's room, and you're going to discard it separately. So it's not going to be like we're all using the kitchen trash can, okay? There's going to be a separate trash can for that patient. People with the following symptoms should immediately stop home quarantine and seek medical treatment. Breathing difficulties, which is going to be chest tightness, suffocation, breathlessness. Also, disorders of consciousness, start getting delirious, confused, not being able to tell day from night, not talking sense. Definitely take them in immediately. Diarrhea, severe diarrhea. Fever or body temperatures that's more than 100.2 or 39 degrees Celsius. Other family members start to develop the same symptoms of infection. Okay, so now on this page they're saying that in spring is also cold and flu time, so what do we do? They're saying go into quarantine anyway because you don't really know. All right. The typical cold usually manifests as obvious upper respiratory tract symptoms such as sneezing, runny nose, throat discomfort, but systematic symptoms are mild, such as no fever or slight fever. The flu usually causes high fever. I think they're talking about the flu usually causes high fever, severe symptomatic symptoms with chills, headaches, systematic aches, nasal congestion, runny nose, dry cough, chest pain, nausea, and loss of appetite. That's a flu. The COVID-19 manifests as fever, fatigue, and dry cough. So you're tired, you're a little feverish, and you have a dry cough. A small number of patients have symptoms such as nasal congestion, runny nose, and diarrhea. If fever, cough, and other symptoms occur, people are suggested to be placed under home quarantine once the following conditions are met. Body temperature is below 100.4 with no obvious shortness of breath, tightness in the chest, breathing difficulty with stable vital signs such as breathing, blood pressure, and heart rate. Without severe basic diseases of respiratory or cardiovascular systems issues or obesity. Okay, so they're saying, if that you have that, you probably got the flu, so just stay home, lay low. Medical management recommendations for patients with fever at home. More rest, keep a balanced diet without fat, oil, and sugar. Drink warm water rather than cold beverages to ensure normal spleen and stomach function. Avoid overuse or inappropriate use of antimicrobials. I know everybody's getting crazy on the antimicrobials, but if you don't have an obvious virus, it's going to start lowering your immune system. Be careful. Wear masks correctly. Have meals separate from the family members. Keep a distance of 1.5 meters, which is 4.9 feet, from family members. People with chills can choose Chinese patent medicines with antipyretic and cold dispelling properties. I teach this in my cold and flu class. That's kind of complicated. If it comes down to it, call me. I'm going to probably start doing telephone consults. People with chills, fever, muscle soreness, and cough can choose Chinese patent medicines with heat clearing and detoxifying, ventilating the lungs and arresting cough. Also found in our cold and flu class that happened in fall. People with fatigue, nausea, decreased appetite, and diarrhea can choose Chinese patent medicines for dehumidification. People with fever and obvious sore throat can choose Chinese patent medicines with heat clearing and heat detoxifying. Join my cold and flu class next year. It's great. You'll learn all of this stuff. Fever with constipation can additionally use diarrhea-inducing fever-appeasing preparations. You get a lavativa. When body temperatures is higher than 101.3, physical cooling measures such as warm towels, ice sticks can be taken. People with this condition are recommended to take anti-fever and analgesics, to take antipyretic and detoxifying herbs. Specific drugs can refer to the recommendation of drugs in the Diagnosis and Treatment Plan of Coronavirus Disease 2019. We're going to be covering this in the coronavirus class, which is this handbook. Family prevention and control measures for patients with fever. So no matter what, corona or sick, 7 days quarantine, just to be careful. Keep the indoor environment clean and ventilated for a half an hour, 1 to 3 times per day. So open everything up 1 to 3 times a day, clear it out. Pay attention and keep the patient warm while you're ventilating. Wear masks correctly. Cover your mouth with tissue or an elbow rather than coughing into the hands and sneezing. Wash hands frequently. That's the one the CDC is telling us about. Do not touch mouth, nose, eyes, etc. with dirty hands. Put down the toilet lid before flushing. They're thinking it might actually be in blood and feces too, but they're not sure yet. Avoid parties, dinner parties, reduce times in crowded places like Costco. People with fever, cough, and other symptoms should be aware of the methods of self-quarantine, such as single room isolation. If not permitted, keep a distance of 4.9 feet. Close the door to avoid air convection between rooms. So you're going to close that person off, but keep that window open 3 times a day. On the way to the hospital, all people should wear masks. Masks used by patients should be sealed in a bag, then placed in a trash can, okay? So you're going to, isolate those masks. Main symptoms, monitoring of patients with fever during home quarantine. Measure and record the body temperature at least 2 times a day. If there is chest tightness, shortness of breath, increased heart rate, pay attention to that. Pay attention if there's digestive systems like diarrhea or vomiting increasing. If those symptoms happen, now you want to go to the hospital. Suggestion of the management of abnormal symptoms when during home quarantine. If the following conditions occur, it is recommended to go to the designated hospital and fever clinics and seek medical care. High body temperature for more than 2 hours, chest tightness, shortness of breath, Respiratory frequency more than 30 breaths per minute, accompanied with respiratory difficulty, cyanosis of the lips. So the lips are going to start to get blue or purple. If that happens, immediately dial 911. For them, it's 120 if you're in China for help. People should be transferred to the designated hospital or fever clinic by emergency medical staff. So don't take them, call 911. This expert advice will further be revised on evidence from clinical practice and should be used accordingly to updates. So I think they're already on update 7. That's the basics for you right now. I know that's kind of long, but this can be life-saving. So please tag a friend, share it. We're going to put it on a few different social media channels. I'm teaching a class. We're probably going to limit class size, and then I'll probably move it online. So stay safe, stay prepared, don't freak out. Stress lowers immunity. Use this time in quarantine to get healthy. Do meditation. Do positive, healthy things to become stronger, healthier, and happier. Thank you.